Namaste, कुछ लोग बिटिया. Today's topic is PT management. PT management is systemic lupus erythematosus. Definition: Systemic lupus erythematosus is an inflammatory connective tissue disease with variable manifestations. SLE may affect many organ systems with immune complex and a large array of autoantibodies, particularly anti-nuclear antibodies. Although abnormalities in almost very aspects of immune system have been found. The key defect is thought to result from a loss of self-tolerance to antigens. It is a disease characterized by relapse, flares, and remissions. Common manifestation is in addition to rash, including cutaneous photosensitivity, nephropathy, cirrhosis, cirrhosis, and polyarthritis. The overall outcome of the disease highly variable with extreme ranging from permanent remission of to the death. Epidemiology: there is a strong female predilection in adults, with women affected 9 to 13 times more than males. In children, their ratio is reversed, and males are affected 2 to 3 times more often. Can affect any age group. They peak age at onset around to second and fourth decade, with 65% of patients presenting between the age of the 16 and 65 years. Disease is more common in childbearing give in women, however, it have been well reported in the pediatric and elderly population. Etiology: a family associate have been noted that is suggested a genetic predisposition, but a genetic link has not been identified. Approximately 8% of patients with systemic lupus erythematosus have at least one first-degree family member, parent, sibling, or child with the disease. Environmental factor: ultraviolet light, infection, environmental pollution, and intestinal dysbiosis. Hormonal abnormality and ultraviolet radiation are considered possible risk factors for the development of SLE. Some drugs have been implicated as initiating the onset of lupus-like symptoms and aggravating existing disease. They include hydralazine, hydrochloride, phentoin, quinidine. Possible childhood risk factors including low birth weight, clinical presentation: arthritis, skin rashes, pulmonary involvement, anemia, kidney involvement, sensitive to the sun or light, hair loss, Raynaud phenomena, CNS involvement, just seizure, headache, peripheral neuropathy, cranial neuropathy, mouth, nose, or vaginal ulcer. The most common signs and symptoms of SLE in children and adolescents are fever, fatigue, weight loss, arthritis, rash, and renal disease. सिस्टमेटिक इन्वॉल्वमेंट में मस्कुलोस्केलेटल इन्वॉल्वमेंट होता है, कार्डियोथोरेसिक इन्वॉल्वमेंट होता है, सेंट्रल नर्वस सिस्टम इन्वॉल्वमेंट होता है, रेनल सिस्टम होता है, क्यूटेनियस सिस्टम होता है, ब्लड डिसऑर्डर्स होती है, एनीमिया हो गया, ल्यूकोनीमिया हो गया. Physical therapy management. Exercise is beneficial for patients with SLE because it is decrease the muscles weakness while simultaneously increase their muscles endurance. Physical therapists can play an important role of patient with SLE during the between examination. The patient need for physical therapy will vary greatly depending on the systemic involvement. Education: it is essential for patients with skin lesion to have appropriate education on the best way to care of their skin and to ensure they do not experience additional skin breakdown. Aerobic exercise, energy conservation. Aerobic exercise is one of the most common impairment that patients with SLE experience is generalized fatigue that can limit their active throughout the day. Graded aerobic exercise programs are more successful than relaxation techniques in decreasing the fatigue level of patients with SLE. Energy and physical therapists can educate patients on appropriate energy conservation techniques and the best way to protect joint care. susceptible to damage. Additionally, physical therapy patient with SLE should be aware of signs and symptoms that suggest to progression of SLE, those associated with avascular necrosis, kidney involvement, and neurological involvement. Thank you.